Why should the world be meditating and practicing healthy movement? Welcome, GynoCurious listeners. I am Dr. Amy Novat. We are here to investigate what it means to be a healer and to be healed. Today, I am speaking with Dr. Elizabeth Levine, an internist, hospitalist, and director of hospital medicine, and chair of the medicine department at Northern Dutchess Hospital in Rhinebeck, New York. Welcome, Liz.
Thank you. Nice to be here.
I'm so glad you're here with me today. I want to talk about healing, because this is a podcast addressing how to be healed and what it feels like to be a healer. And I want to ask you first, what does healing and health mean to you?
Good question. Let me take a moment, like I have to do for many things, to think about that. So I think that I could speak to it easier if I think about what I think healing is for my patients.
Go for it.
So I could start from there, and then I'm happy to bring it back to myself and my other coworkers. So healing for my patients is for me to be able to present to them the best that they can be given the circumstances. So I work in a hospital. People they're having a hard time, otherwise they wouldn't be there. So given the circumstances, how can I enable this person to be the best that they can be and get what they want, basically, within reason, right? Because we can't cure people all the time, but healing is bringing somebody to that space maybe of acceptance about what is going on. Yeah, I would say my job is to have a person see and accept where they're at.
I love that definition, because often the verbiage that is used around health and healing is about, balance and running a marathon and all kinds of external evidence, if you will, that you can push against the hard parts in life. And that's part of what you're talking about, but this idea of being the best that we can be. And I guess that's different for everyone, right?
Absolutely.
Yeah. What does that look like for you?
Well, as I'm saying all of that, I can apply that to myself. So when I show up to work and I'm giving my best to others, whether it be my coworkers, the staff, patients, I need to accept where I'm at too. I have to be in a place where, I bring things with me. I mean, things happen, families, I come to work and I have stuff. And I'm going to do the best I can. I can't always be 100%. So I think it's the same, that I'm working on accepting where I'm at constantly.
Yeah.
And giving the best that I can.
Physicians, clinicians struggle with the perfection complex. And I know as a doctor, I've said this a few times on this program, and it bears repeating. The first day of medical school, I think he was the president of the college. I don't remember who it was, but some white male stood up there on the stage and said, "You are now all God." And I was stunned.
Yes.
But that was clearly the message that was being given to a group of extremely already somewhat arrogant folks. And that attitude, I think, is dangerous, because we are human. We have faults, we have flaws, and we do the best we can do. But that's, sometimes things happen because we're human, and so are our patients. So I know that some years ago you started to practice yoga, and I want to talk about that. And I wonder if that's part of what you do to be the best that you can be.
Yeah, so I could give you a little history. My mother, when I was in college, I was in my 20s, opened a yoga studio in Long Island in a place of lots of materialism. And so she influenced me, and I kind of got into it when I would come home from college. which is interesting because my mother also drove me to be that perfect, high-achieving person. So she also gave me the experience of yoga as well. So I thank her for that, because I think I'd still be like barking up the perfection tree. So I got into practicing, and eventually when I moved up to this area in 2010, I took teacher training only because I wanted to deepen my practice. I had experienced some amazing teachers who taught me some of the philosophy. I mean, I loved the movement. I loved the practice, the physical practice, but the philosophy of being a witness, of being true to ourselves, and all of this was kind of new to me, and it really helped me so much. So I got into taking lots of trainings, being the overachiever I am. I got lots of hours and had, Sandra is my teacher, and she's now like a really close friend and sister, and she just taught me so much about the practice and living life in that kind of way. So the accepting myself as I am, being truly authentic, it took years to really bring that forward. And my goal is to just teach that to as many people as I can.
Thank you for that. Thank you for that. Yoga has become somewhat of a trendy phenomenon. So I'm grateful that you're pointing out some of the deeper philosophical teachings of the practice. I suspect, I don't practice yoga, so I don't know this, but I suspect, like many trends, there is often kind of a superficial practice, if you will, and that when you dive deeper, that's when it truly starts to apply to daily life. So I guess you've already pointed out some of the deeper teachings. What would you share with patients that you've learned through your yoga practice?
Well, I think it's yoga and meditation and mindfulness. Mindfulness, I think, is the thing. I mean, it's part of meditation and yoga. So mindfulness is the thing that I bring to the bedside all the time. I had a patient with a lot of anxiety yesterday, and normally I think my reaction is to want to jump out of the room because, we get anxious when patients get anxious. Again, we're human. So I use my own practice to relax myself, become very mindful, and try to attune to her that she's anxious, and I'm empathic, so I feel that. And I try to teach her to do the same type of practice, to use her breath. I taught her box breathing. I taught her to take a wider view because she was being very negative, and that it's not either or, it's this and that and that. So I thought that was a good example of what I bring to the bedside.
How did your patient respond to that?
She liked it.
Yeah.
Yeah.
So you're working in a very conventional allopathic hospital, and words like mindfulness, yoga, meditation, even though they're certainly out there now, these are not new concepts in the world at large. How has it been bringing that practice into the hospital?
I think at first I was nervous about it because I felt a bit of a outsider, like a freak. But as I have more responsibility in the hospital and I weave it in more, I feel like people like it. I feel like people like it. So I try not to be too forceful with it. I just, like I said, I weave it in. I try to weave it in. Yeah.
Yeah, I think there are going to be folks out there who are not willing to embrace it. Why do you think that's true?
No, I know what.
Tell me.
People are so afraid to look inside.
Yeah.
I mean, when you practice mindfulness, especially healthcare workers, we see such hard things. I mean, COVID, what we were seeing. So to take a moment and actually feel that, people are afraid they're not going to be able to manage, that they're going to break down and something awful will happen. So it's, this is part of that training, that we're God, and, we don't have feelings. We don't break down. I mean, we are trained to be that way, and to be untrained is really hard. It's really hard.
Yeah, I mean, kind of centuries worth of dogma around that, right?
Totally.
Yeah.
Yeah.
Yeah. It also, it makes me think about the hierarchy that exists in the hospital, or often does. Doctor on top and nurses below and techs underneath them, and a very rigid hierarchy that I personally find extremely non-productive and not particularly helpful to the patient from the moment they walk in. Are you talking to the greater community about mindfulness, or how are you using mindfulness and meditation and yoga for example, the residents?
Yeah. So the greater community, I think you mean like the environmental staff and maintenance. Yeah, I try. I try. We've done some things, and I think that it's been good. So I try. But in general, as you know, Northern Dutchess is such a friendly place. And it doesn't feel, when you're out there in your day-to-day world, you don't feel like the people cleaning the room are different than us. Like, you really feel like we're a team, and the patients, I think, feel that way as well. So how do I bring this to the residents? So I could go back to that superficial meaning of well-being. I think that people like the residents would love for well-being to be going to like a brewery for our well-being hour, or going bowling, or not even so much a walk. The weather has to be perfect for the walk.
An outing.
I took them on a walk last week, and it was hot. But it's that external stuff that people want to do. Again, because it's hard to do the stuff that's looking deeper inside. So what I do is I have this hour, and I try to have something that's fun, like we do a walk. But we also talked about what is the difference between wellness and well-being. And we explored that a bit. And I tried to get them to think about ways that they will cultivate their well-being. And the difference is, to me, wellness is something like on the outside, like I go for a run, I do a yoga class, I go see a friend. That's outside stuff. The well-being is, what do I do when I just witnessed my first patient who died, and I'm feeling all alone, I'm sad, I want to cry, but I can't. Like, what do I do then? That's well-being. And that's what I want to teach them. And it's not like they're like open arms wanting to do this work all the time, but I tell them, you're going to thank me one day, because we never had this kind of teaching.
I'll thank you, and I haven't even been a recipient of that teaching. And boy, do I wish I had someone talking to me about this as a medical student, resident, even as a young clinician. So I applaud you, because again, the structure of education, medical education, is not one that addresses our personal fears, emotional landscapes, our personal needs.
Absolutely. I mean, how many times have you been around a provider who is probably triggered and is acting out? Happens, right?
Yeah. Yeah. Can you speak more about that so our audience understands what you
mean?
Well,
I could say it happens to me.
Mm-hmm.
It happens to me. I'll see somebody who like reminds me of my dad. And so this may not be a trigger in such a traumatic way, but my dad had dementia a long time. I might see a patient like that, and I may want to just cry because I miss him in that moment. So if I'm not mindful that that's what's going on, like naming it and saying, oh, I'm sad, while I'm listening to the patient or seeing the patient, then it could come out sideways. I could just want to walk out of the room.
Yeah.
Which isn't good.
Yeah. You're speaking about transference and projection, and these are concepts that are well studied in the world of psychotherapy, but unbelievably never mentioned, at least again in my medical training. And it happens every single day. Someone reminds me of my grandmother. Someone reminds me of a patient that I lost when I was, a new intern. And I go back there immediately. And recognizing, yes, the emotions that are being triggered, the events that are being remembered, these are all so much an important part of how we are in the room, how we are in our body, how we are in our emotional plane. These are things that you and I, yes, never were introduced to as young clinicians.
Absolutely.
Yeah.
And I find that when I have that feeling with the patient and I share, it's fine. Like when I say, so maybe not maybe the patient with dementia, if they're communicating with me and I'll say, you remind me of my dad, and I'll talk about him, and patients love that. I mean, again, it makes us human.
We were trained to never apologize and never to speak truth to our faults. That's slowly changing, I think. What do you think?
I think it is. Yeah. I don't think your person who stood up in medical school and said, "Congratulations, you're all God." You can't say that anymore. I mean, that's a great thing. Yeah. So I think hopefully people like our generation are examples for the younger generation that we're not perfect. We get sued, we get patients are mad at us, like not every patient loves us. I mean, that's not easy.
Yeah, we are still in community, whether it's in a hospital or a doctor's office, that it's still relational. And sometimes it doesn't really work, or sometimes it doesn't feel good. From both perspectives, right? Again, my tagline is from the other side of the speculum. Sometimes I'm in a room with someone who makes me uncomfortable, either because their anger is so filling every space in the room, or speaking ill of, some people will walk in and say, "Oh, every doctor I've seen is this, and this." And so I'm already feeling like, oh my gosh, how do I have to perform in this space? That's hard.
It is hard.
Yeah.
It's really hard. And sometimes being honest in those situations, saying, I don't know, like I was thinking, so maybe saying that this kind of makes me a little uncomfortable. Like I would do something like that more these days. I would never have said that in the past. Never. Because we were taught not to.
Yeah.
Yeah.
I have to share an experience I had. This was some years ago, where a patient I saw regularly on an annual basis used to come in and terrorize my staff. I mean, was so angry. And from the moment she walked in to the moment she left, my staff was on high alert. And eventually she came in, started downgrading my front staff, and I brought her into a room and I said, "This has to stop. I so want to help you be well. I want to take care of you. I'm at your service, but your anger is upsetting everyone in the office, not just as they anticipate you coming in, but after you leave, it reverberates for hours." I was like, "What is going on?" And that woman started to cry. And she began to tell her story. And her story was of trauma associated with doctors' offices, starting as a young child. And all of that was building up as she was walking down the path towards our office. And so when she came into the office, all she could feel was defensive and anger. And I tell you, she became our favorite patient after that.
You should write that and publish it somewhere. I mean, that's the thing. You made it safe for her to be honest.
Right.
And you were honest.
Right.
So if you just kept, not addressing it, or if the staff didn't address it, then it just would have kept happening. And
Right.
she wouldn't have had a place to be open.
And really, truly be healed.
Yeah.
True.
Seriously.
Yeah.
That's it.
Yeah.
That's it.
Yeah. Today I'm speaking with Dr. Liz Levine, an internist and hospitalist, about healing herself and the medical system. So, Liz, there's so much conversation right now about physician burnout, compassion fatigue, moral injury in the lay press, and certainly in our own medical community. Can you speak to us about these issues?
Well, one of my teachers, Joan Halifax, who's a Buddhist monk, and she's amazing, does a lot of work in this area, has done it for years, even before COVID. So burnout, to me, isn't the greatest word. Burnout feels like there's something more I can do to change this feeling that I have. It feels like something that's put on me, and that's something that I'm responsible for. So I love the moral injury part. And I think I would explain it as when I'm really practicing well, when I'm taking care of patients well and with my staff and, colleagues well, I'm aligned with what I believe in, my values. Now, when something tilts that, it could be something like COVID. I mean, that totally put us all in moral distress, really. When something changes the healthcare system, absolutely does that. When we have to see patients, certainly you in the outpatient setting have to see patients every 10, 15 minutes, that's moral injury because we can't do that. You can't give what you want to give, so you come out of alignment. So I think of it as I'm trying to be in my center, and this is also what mindfulness is. Things are going to take me off my center. I don't have, I used to think I'm going to try to make everything better and change the world. But I don't feel like that anymore. It's impossible. So just like healing with patients, this is what I have. This is what I have to do. I could try to make some changes, and maybe by weaving in this whole idea of well-being and all that. But this is what I have. I'm going to be off center a bit, but I'm going to keep trying to get back and keep doing that. So that is what that means to me. And the answer is all the stuff that we just talked about, and not like a 12 o'clock meditation that I could call into that my corporation is offering. I don't think that is the answer. I don't think it hurts us, but I don't think that's the answer. I think it's the deeper work.
Individually and as a community?
Yeah.
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 Yeah. How do we, at least in the microcosm of Northern Dutchess Hospital, where we both practice, how do we prevent these issues from eroding our medical community?
Well, we continue to have great leaders. I mean, that's important. And our leaders, I like that they seem to be into reflection and their own well-being, and they understand like my messages and what I'm trying to do. So I think that's very helpful. We have something called Schwartz rounds, which is when we get together about a topic or about a patient, and we speak to the emotional impact that had on us. And this is like revolutionary.
It is.
There was never a space for this. And this was created by Ken Schwartz, who was a patient and had cancer and couldn't believe the care that he got, and felt that these people needed a space to be able to speak their truth and about their emotions. So we do that, and that's amazing. We have a support team that we offer support for anyone who's going through any distress, or if something happens, and a group of us may come and do like a talk, not a talk, just support everybody. And we have something called a peace of mind, which is, this came about because we had a provider who had something tragic happen to his somebody in his family. And so we wanted to have a space where people felt that they could just come together and just talk. And we're doing Pema Chodron's book, When Things Fall Apart, and we're doing a chapter a month. And the kind of stuff we're talking about is amazing. And it would help anybody who's kind of suffering, but also who wants to be around a healthcare worker who's understanding more of what suffering means in that environment.
I love that you're bringing in these leaders of mindfulness in the global realm into the world of Northern Dutchess Hospital. And you use the word radical and revolutionary. It truly is. So I so applaud you for doing what you're doing, Liz, because it takes courage. It takes courage for us. I'm gonna say, as women, as medical leaders, to bring in something new, and this is new. It seems obvious to you and me,
Yeah.
but it is new. So I guess I'd ask you, if you had the opportunity to design a medical system, educational system that included yoga and meditation, kind of what would that look like, and what else would you include? Are there other modalities that you would include?
Yeah, I think I would want the people who are being educated, so in this case the residents, to create it themselves, because not everybody, what I've learned too is I can't put my yoga on everyone. Not everybody likes that. So what I try to have them do is investigate and get curious about what works for them. Like, look inside, what brings me joy. We did a session on joy last year. We played Duck Duck Goose. It was so much fun. So what brings us joy? So everyone is different. So I would be hesitant to create a program without having them create it, which in and of itself is therapeutic, to be creative and feel like you're part of this community that makes that. So that's what I'm trying to do. I do think that getting help, like the act of getting help, like professional help, needs to be part of that too. That's available, that, there's nothing wrong with it. I often tell my residents that, I'm only doing this because I've had tons of therapy and I've been able to be in this place to do it.
Mm-hmm.
Yeah,
Mm-hmm.
Without help, I don't think I'd be here.
Yeah, yeah. Just the acknowledgement again of our humanity is such a gift that you're giving these residents, because they, again, are being told over and over again, there's a certain way you have to be, and that's robotic and unemotive and not taking care of themselves. And I think you'd agree, leading to a less effective healer and healing.
Absolutely. Yeah.
Yeah. So you brought up joy, and as we move towards the end of the show, Liz, I've been thinking a lot about what gives me pleasure. And this is not a question I've asked myself much in my life. It's kind of a new question. And so what gives you pleasure?
Being on top of a mountain. But not just like being dropped there. I wouldn't like that. I need to climb the mountain. So, it's a big metaphor for, just doing the work that you need to do to just get somewhere that you so feel good in, like being on top of a mountain, seeing a beautiful view, having achieved that hike, let's say, and being in nature. So that every time I think what brings me joy and that feeling like that you just want to smile, that's what I love.
I'm so glad we're living in the Hudson River Valley, where there are beautiful mountains for you to do that.
Absolutely.
So may that continue to be a part of your life. Yeah. Thank you, Liz, for joining me this morning. I would encourage everyone out there to find a way of breathing deeply, listening to the sounds of your breath on a regular basis, and to use practices like yoga and movement to help you cope with the stressors of life and to assist you in being your healthiest self. Please join me each episode, and if you like what you hear, subscribe and follow us on whatever podcast app you're listening on. Share with others so that we might all continue to learn. Thank you to my producers, Jen Hammoud and Matty Rosenberg. Until our next conversation on GynoCurious, please stay healthy and stand strong with knowledge, insight, and intuitions.